I don't think it gets any clearer than that. Donate blood, save a life. Every 2 seconds, somebody needs blood. This morning, I want to welcome the Honorable Terence Yal Singh, Minister of Health, alongside head nurse slash coordinator, Nurse Nelva Miller, to join us to talk about the true voluntary blood donation or the non-remunerable voluntary blood donation. Either way, good morning and welcome to the Now Morning
Morning,
Show.
my friend.
Good morning, morning.
How are you guys doing this morning?
Not too
Fine,
bad.
thanks, not too bad.
All right, so we saw in that video where we basically want people to come out and donate their blood. We always see, when something happens or somebody is diagnosed with a particular disease or they need to have surgery or whatever the case is, that you run and ask your family member, you could go and donate 2 pints, a pint of blood for me, you ask your friends, you start to collect all these chits and all of that stuff to be able to go into the hospital and say, all right, I have enough blood for this person to get surgery. Is that what we're trying to fix, or what was the situation with this true voluntary blood situation?
So that is exactly what we are trying to fix.
Mm-hmm.
I think everybody in this studio and everybody listening would at some point in time, either themselves or a relative or a friend, will need blood.
Mm-hmm.
Whether that patient is in the private sector or the public sector. There's a misconception that what we are trying to do is only for the public sector.
Right.
But we collect blood for both patients in the public sector and the private sector.
Because
people didn't know that.
Private sector also uses the same blood bank.
The same blood bank, and it costs about 2,000 TT to process 1 pint of blood wherever it goes. Whether it goes to a patient in a private facility in the west, in the south, in the east, or a public sector. What we are trying to do is to build up a database of about 20,000 persons who have the country's interests at heart to be what we call altruistic. In other words, I give my blood and I don't care who the blood goes to. As opposed to now, I give blood and I direct it to somebody.
Right.
What about that person who doesn't have relatives or friends to give blood?
Right. Okay. And what about situations of emergency? Those also require blood donations.
So you have a gunshot victim, an accident victim. Your child is in a motor vehicle accident, needs blood now. You don't have time to go and find 4 relatives for them to go and give blood. That person could die.
Yeah.
We want to move away from that, right? So we have rejigged the entire system. But we are asking people now with public education to understand that you have within yourself this ability to give 1 pint of blood and save 3 lives.
All right, I wanna bring Nurse Miller into the conversation now, because you're saying that we can give of our own blood, and that's fine. We have heard of that happening so often. But if I'm doing that regularly, is there any cost to me in terms of my health? Would my health suffer as a result of me giving blood?
Okay, well, there will be no cost to you giving blood, because when you give blood, you will have a free health checkup whilst giving blood, right? And also, you'll find out about your blood group, and then according to what the minister said, 1 unit of blood saves 3 lives. Good. So when you do that, now you do a good for your country and for the people out there who are suffering from blood donation, because a lot of times there are patients who cry out for blood, and we have to call out on the radio stations, TV stations, asking them for people to come in to donate.
Do you have any idea right now, like, all right, I don't know how it works, so forgive me, right? But in the blood bank, is it that we have a storage of blood and it has to go to particular people, or is it that we're running low on storage, or how does it work?
Well, sometimes we run low, but however, since we have recently renovated the blood donation center and rename it after Dr. Waveney Charles, which is the first registered hematologist in Trinidad and Tobago, and she's also the founder of blood donation. She taught the nurses from all the blood banks how to go about recruiting donors and try to educate donors and push a positive vibes and positive attitude to come and donate.
Right, but in terms of storage, like, is there a minimum that we always have in store, or is it that we deplete our resources and we need to build back up? Or?
Well, resources are sometimes depleted, and based on COVID-19 hit us really hard. Right. Due to that, we had a drastic depletion of blood, and then because of fear of the unknown to the public, where they are afraid to come and donate due to the COVID, right? And because of that, now we have the mobile that was loaned to us by the Ministry of Health. Minister, thank you for that.
Well, they don't fall under the Ministry of Health too?
Actually, this is a joint effect.
Okay.
With the NWRHA and the Ministry of Health.
Okay.
Right? So we go about in the communities. We have different companies who we go to, and they are the ones who really sustain the blood bank with the voluntary donation that comes in. So at least there are times we'll have the patient, and there are times we'll have a drastic flow.
Right.
Right, according to the amount of persons that comes in.
How long does it take for me to build back up that pint of blood within myself?
Well, usually it's every 3 months for males and 4 months for females.
Okay.
Right. However, when you give that blood, good, it's not like you could build back up at the next 24 hours or so, because of the fact that some people, when they come and give blood, they want to go and play a little football after.
Right.
You give yourself 24 hours to go and do any kind of sporting activities or anything like that.
And is it I just in terms of your physical body, how it reacts to it? I know people tend to get lightheaded. They tend to feel a little bit weaker. I mean, I know you recommend no alcohol, no heavy physical activity after giving blood. But what happens in that 24 hours that makes you better?
Well, usually when you give blood, before you give blood, I would advise people before you give blood, have at least 400 to 500 mils of water, right? So when you do that now, when you finish, you wouldn't feel dizzy or lightheadedness or anything like that. And then when you finish donating, continue replenishing your fluids and stuff to build back up yourself.
Right.
So that wouldn't happen.
Okay. Is there a weight limit to who can give blood? I know that there are certain restrictions and they follow the form, but is there a weight limit?
Well, it used to be, but by the 14th of June, which was World Blood Donor Day,
right,
but we had a newly renovated blood donation center renamed after Dr. Waveney Charles. We have a pre-registration system online right now. We have the pre-interviews done online, so it makes the wait less than 40 minutes.
No, I don't mean WAIT, I mean WEIGHT.
Oh, wait.
Yeah. Like if you're too heavy, can you give blood? Like, is there a...
sure.
No, so people ask because they always think that you have to be of a particular standing in terms of health-wise. You have to be a particular fitness, you have to be a particular whatever to be able to give blood. But what are the requirements?
No, you don't have to be a particular weight. The chairs that we have holds up to 450 pounds and more, right?
Yeah. So what they will do?
Yes.
There's a pre-screening list online.
Right.
The person goes online and does that pre-screening list. It will talk about weight. It will talk about tattoos and stuff like that.
Right.
But we have made the process so simple. But you would ask Nurse Miller about blood donation supply. What we want to do with this system is move away from this fluctuation of supply.
Right.
So that we want a supply that is predictable, that we constantly have a known level of blood in the system,
right,
to prevent this fluctuation. Feast today, famine tomorrow.
Yes.
Plenty blood today, no blood tomorrow.
Yeah.
We want to move away from that and get a steady state so that normal circumstances, somebody needing blood is guaranteed blood. And even to account for emergencies, like you have a mass casualty event, let's say, God forbid, as we did have some years ago, a PTSD bus on
the highway.
Suppose you need 30 people all of a sudden needing blood. This system will cater for that. So we want to move away from these fluctuations to have a steady, predictable, safe supply of blood in the system.
With the online system, are we concerned at all about honesty or lack thereof?
Well, no system is absolutely foolproof.
Right.
So the online system is a self-screening tool, but then on the day itself, you go through a further medical checkup.
Okay.
So that's a final check and balance to make sure the information we are getting is right.
And for those that have never done it before, maybe they may be nervous about the process. They may say, "Oh gosh, I don't really like needles. I don't really want to do that." What can you say to reassure them this?
Well, what I can say, we have a very hard-working crew at the blood bank. From the time you stepped into that Waveney Child Blood Donation Center, it is very welcoming. My staff will welcome those donors, and when we are finished talking to you, definitely that fear will be relieved for you to come and do it, because there are many people that are afraid of needles, especially meals. Good? And we will reassure you when you get there that you have no fear. So when you sit on that chair, I know for sure you'll be comfortable.
Yeah, if there's one thing I would say about but at least my experience in the blood bank
Yeah.
previously is that they would definitely distract you.
Yes, we do that.
And Nurse Mother
We
could
do-
tell you we
yes.
have retrained every
Yes,
single nurse.
every nurse have
she
been
could
trained.
talk about
Yes.
that.
How was that training process? When did that happen? During
That happened during the month of April, May, where we have retrained all our blood bank staff. They are very confident and could reassure you of that, because the distraction, well, we are very good at distracting people when you come into that blood bank to face that big needle, because
Yes.
people are really scared when they come inside there. Before they even see that needle, they are afraid.
Yeah.
Right? So if I'm approaching you, I will distract you, make a little joke with you, and by the time I stick that needle, you will
You even realize
you
it
will
reaches,
realize
yeah.
that you are bleeding already.
Yeah, well, I
Right?
mean, I think that this is a great initiative, and I do support it 100%. I mean, I currently do give blood, but it's encouraging to know that
Yeah.
we want more people to
But we
on a
want-
more
yeah.
regular basis.
Yeah, so we want about 20,000 persons on our registry
Right.
to give blood twice to 3 times a year. If we do that, it means we are collecting 40 to 60,000 pints a year, as opposed to currently 20,000 pints a year. So that's
okay.
the objective.
Okay.
So that, as I say, we have a safe supply of blood, a predictable supply of blood, a known quantity. But we are now reaching out to the public. Become a true voluntary blood donor. Do it for altruism. Altruism
Be a
is
patriot.
I do something and I have no care in the world
Yeah.
as to who benefits.
Right.
As opposed to currently, I direct my blood to somebody. That is not good.
Yeah.
Put yourself in a position, my 6-year-old child needs blood now. Think about the stress you have to go through now to find blood,
Yeah.
on top of the stress of dealing with your child.
Are we looking for a particular blood type, so we taking all?
All.
All are welcomed. All right. Well, I want to encourage each and every one of you to please go and donate your blood. Was the website we had across to do the pre-screening?
Just go on the Ministry of Health.
The Ministry of Health
Yeah.
website. That's
It's easy.
Yeah, that's moh.gov.tt.
Something like that, yeah.
Yeah, I believe so.
Just type in Ministry
Yes,
of Health.
Just
Yes,
Google
health,
Ministry of
yes.
Health,
You get
you're
it.
bound to find it.
Health.gov.tt.
Health.gov, that's what it is.
That's it.
Health.gov.tt.
Health.gov.tt.
Before we wrap though, Minister, I know that you mentioned this week in a press conference
Yes.
about monkeypox and us being aware of it. Before we wrap up, is there anything you want to mention to
Yeah,
the nation
sure.
again, just to because I know we see it in Venezuela, we see it in Miami, where everybody always love to go.
Yeah,
So what concerns should we have as Trinbagonians?
Yeah. So as citizens of Trinidad and Tobago, your concern as an individual is to make sure that if you're in close contact with somebody who has recently traveled to one of the 42 countries now identified as having monkeypox, 42 countries, including the United States, England, Canada, Venezuela, be careful, especially with prolonged skin-to-skin contact, sharing bedding, sharing clothing.
How long did they say it takes before you're able to identify symptoms of monkeypox?
The incubation period is 5 to 21 days, so
Wow.
it's kind of broad.
Yeah, boy.
So we are asking people to be ultra careful with prolonged skin-to-skin contact, sharing bedding, sharing clothing with anyone who has recently come back from a country, from one of those 42 countries where monkeypox has been identified.
All right. Well, I want to thank you so much for joining us.
Thank
this
you
morning,
very much.
Minister and Nurse. Thank you very much. And I want to encourage each and every one of you to please go out there and donate. Donate your blood. I know it might seem scary for some, but for those of you who aren't scared, you go. Those of you who are scared, the nurses will reassure you when you get there that you are doing something good. And it's for the good of the nation, not just for you alone. It can benefit your neighbor, your friend, somebody you don't know who actually really, really needs it. Yeah? So head across to health.gov.tt
Yes.
and you can sign up and register to be pre-screened and make your appointment to go and donate your blood. Thank you again to the Honorable Terence Dial Singh, Minister of Health, as well as Nurse Nelva Miller, the head nurse / coordinator at the Blood Donation Center. Thank you guys so much for joining us.
Thank you very much.
Thank you very
We'll
much.
take a quick break and come back with more in our morning.